بسم الله الرحمن الرحيم. شلونكم طلابنا؟ المرحلة الثالثة. We will discuss today mineral. What do you mean by minerals? We have to know it is part of our nutrition and we have to know what is it. It represents only 5% of our body weight and mainly 50% is calcium, 25% phosphorus and other minerals. It constitutes the remaining 25%. So when we said the required daily allowance of minerals is more than 100 milligram per day, this we mean the micro minerals including calcium, phosphorus, magnesium, sodium, chloride, potassium and sulfate. While if the requirement of minerals is less than 100 milligram per day, we call it the micro minerals or trace or ultra trace minerals or elements. They included iron, zinc, copper, iodine, manganese, chloride, and molybdenum, cobalt, selenium, chromium, nickel. These are the minor or trace elements. So what's the function of minerals? Usually we have to know that they are dissolved in as ions in the body fluid, and they regulate many activity of enzymes and maintain acid-base balance and osmotic pressure, and also they facilitate the transfer of essential compounds through cell membrane. They maintain the nerve and muscular irritability, and some minerals involved indirectly in the growth process. So macronutrients we will talk about here. First of all is the calcium, which is the most important part. As we said, it is constitute about 50% of all minerals. They found 90% in bone and teeth and the remaining 1% in the body fluid as isotonic calcium. The function here, they have hemostatic function. They control the calcium level and they maintain the CNS function, maybe as you know, for a nerve conduction, a nerve impulse, and blood clotting. They prevent clotting, they prevent bleeding, and also they maintain the blood pressure regulation and facilitate the transport of materials and nutrients across the cell membrane. So when the calcium level is decreases too much, so calcium hemostasis start and the bone is will release calcium, and this release calcium from the bone is controlled by the parathyroid hormone, and they will end with formation of calcitriol, which is an active form of vitamin D, and this also will be responsible for the increased intestinal absorption of calcium and retaining of more calcium through the kidney to maintain the blood level of calcium. And the recommended daily requirement of calcium is 800 milligram for male and 1200 milligram for female ages between 19 to 24 years and old age. They have to take them for 3 times per day with a calcium rich food. So what are the food sources? The milk, dairy product, sardines, ice creams, molasses and sesame oil. There are some certain types of food that decrease in calcium absorption because they contain an oxalic acid, like spinach, broccoli, kale and beans. In addition to tea, coffee contains oxalic acid. All these decreasing absorption of calcium, and we have to remember that. So what's the effect of calcium deficiency? There is osteoporosis and osteomalacia. Osteoporosis, there is abnormality in bone structure. Osteomalacia occur when there is vitamin D deficiency as a cause for this calcium deficiency. There is tetany, muscle spasm, leg cramps, irritability of the nerve fiber, sometimes end with convulsion, and this occur when there is reduction in the calcium phosphate ratio. Also, hypertension occur because of abnormality in calcium metabolism. What factors increase calcium absorption? First of all, they increases in cases of pregnancy and lactation because they need higher demand of calcium, and milk lactose also favor the absorption of calcium, sufficient vitamin D, and if there is the acidity of digestive tract. Why? Because calcium is mainly soluble in acidic medium, which increase absorption. But what the factors that decrease calcium absorption? First of all, the binders like phytic acid and oxalic acid. These will decrease the absorption And also, whenever there is dietary fat, it will form an insoluble soap with calcium. And dietary fibers and laxative also, and excessive phosphorus and magnesium intake, and also there is aging process and sedentary lifestyle and certain drugs. All these decreases absorption of calcium. Now we will talk about the phosphorus. 80% present in the bone and teeth in form of inorganic portion. They are important, also present in the every cell, and the RNA, DNA, and ATPase and lipid, phospholipids. They are important for the pH regulation. The recommended daily allowance for adult is 800 milligram for male, 1200 for female, and the food sources: cheese, egg yolk, milk, fish, poultry, whole grain cereals, legumes, and nuts. Is there any type of phosphorus deficiency? Usually it not occur, but especially if you take a lot of protein and calcium intake, so the deficiency is very rare or not occur. Magnesium, it is present in the bone in 50% and 49% in body cell and only 1% in the extracellular fluid. The function: activator for enzymes. Magnesium is acting as a coenzyme or activator for enzyme. So the daily recommended amount: 350 milligram for male, 280 milligram for female, and the sources: the whole grain cereals, nuts, meats, and milk, green vegetables, legumes, and chocolate. Also, magnesium deficiency is unlikely, but sometimes may associated with surgery, with malabsorption, alcoholics, and loss of fluid, body fluid, and hormonal causes and renal causes, although it is rare but may occur. What about sodium? It is present in 30 to 45% in bone and the extracellular fluid, and a small amount present inside the cell. So it is mainly an extracellular type of mineral. The daily allowance is 500 to 3000 milligram, and usually sodium, as you know, it is present in table salt, in seafood, animal food, milk, egg, and in most food except fruits. Except fruits, this is important. So sodium deficiency, the dietary inadequacy, never occur. Never occur. And we have to decrease the intake of sodium, especially in patients with the cardiovascular diseases. Chloride, this is the major anion of the extracellular fluid. And in addition, or in combination of chloride and sodium, they act as buffer system to control the pH. Also, they act as enzyme activator, and they are component of gastric content fluid as HCl, and also 15% is found inside the cell. The recommended daily allowance for adults is 750 milligram to 3000 milligram. Food sources also: salt table salt, seafood, milk, meat, and eggs. The chloride deficiency also, it is little but sometimes occur when there is vomiting, diarrhea, and profuse sweating. It may occur. Potassium, located also, it is a major cation of the intracellular fluid, and a small amount present in the extracellular fluid. You have to remember that this is a major cation. Potassium is positive charge, so we call it the cation. It regulates the pH and osmolarity, and also to play a role in carbohydrate and protein metabolism. So daily recommended allowance is 2000 milligram. The food source is fruit, milk, meat, cereals, vegetable, and legumes. Is there any evidence of potassium deficiency? Although in dietary inadequacy is unlikely, but this occurs in patients with renal disease and with diabetes, with acidosis, and whenever there is excessive vomiting, diarrhea, and sweating. Potassium excess is another problem. It occurs in renal failure and in severe acidosis. Sulfur is another macronutrient, and it is present, important for the synthesis of essential metabolites and in oxidation reduction reaction. They are satisfied by essential sulfur containing amino acid. The food source are protein, meat, fish, poultry, eggs, nuts, milk, cheese, legumes. Is there any deficiency? It is related to protein intake. Deficiency related to protein intake, whether there is deficiency in the protein, sulfur deficiency are together. We will talk now about the micronutrient. First of all, iron. 70% of iron in hemoglobin and myoglobin. 26 is stored in the liver, spleen, and the bone. Why iron is important? It is important for a transfer of oxygen to the whole body, and it is present as a transferrin and important as it's present in certain enzymes. The adult requirement or daily allowance is 10 mg for male, 15 mg for female. And the food source, as you know, is liver, meat, egg yolk, and legumes, whole or enriched grains, dark green vegetables. And we have to know, is there any iron deficiency? Yes, occur in female, and iron deficiency in female mainly during reproductive years, and it occurs in infant, in preschool children, and in cases of unusual blood loss, parasite and malabsorption, parasite infection. Anemia is last effect of deficiency state. We will talk now about the iodine. It is the constituent of T4, thyroxine. Thyroid gland, which control the reaction of cellular energy. It is important because the iodine is important part in the cellular energy production, as it plays a role in T4 formation. Adult requirement 150 microgram for male, 175 microgram for a pregnant, and 200 microgram for lactating female. The food sources is ionized table salt and also seafood, water, vegetable in non-goitrous region. Whenever there is iodine deficiency, they will end with endemic goiter. We call it the endemic or simple goiter. Especially it occurs in females, adolescent, in pregnancy or lactating women. The zinc is present in most tissue, in liver, in voluntary muscles, in bones, and it is important as they are constituent of many enzymes. And insulin, important in nucleic acid metabolism. The daily allowed requirement is 15 mg for male, 12 mg for female, and it is present in shellfish, in liver, in legumes, milk, and wheat bran. Zinc deficiency is important here. There is systemic childhood illness. It is a hereditary type, and this patient, especially in children, they got zinc deficiency, acrodermatitis enteropathica, they got chronic diarrhea and the skin manifestation. Patients also with a nutritional depletion are liable to have zinc depletion and deficiency, and patients subjected to severe stress as in post-operative state. Copper is present in all body tissue, in the liver, brain, heart, kidney, and they are constituent of many enzymes in RNA, DNA, and the daily allowance 1.5 to 3 mg. They are present in liver, shellfish, whole grain, cherries, legumes, kidney, poultry, nuts, and chocolate. Copper deficiency, there is no deficiency, dietary deficiency, only in disease of genetic disorder there is copper deficiency. Manganese, highest in the bone, in pituitary gland, in liver, pancreas, GIT. Also the constituent enzyme and in mitochondria of liver cell. Daily allowance 2.5 to 5 mg. Food sources, the whole grain, nuts, legumes, fruits, and tea. And manganese deficiency is unlikely. Fluoride, this is important as it is present in bone and teeth. The optimal amount in water and in diet, they reduce dental caries and minimize bone loss. So they are important to prevent dental caries and to minimize the bone loss. Daily requirement in adults is 1.5 to 4 mg, and food source is usually drinking water as it contains should be fortified with fluoride. Tea, coffee, rice, soybeans, spinach, gelatin, onion, and lettuce, these are the sources of the fluoride. And the fluoride deficiency also, it will cause dental caries. Selenium, associated with the fat metabolism and vitamin E. It is an antioxidant function, and it is present in adult in 70 microgram in male, 55 microgram in female. They are present in the grain, onion, meat, milk, vegetables, depend on the content in the soil. And deficiency of selenium causes what we call the Cashan disease. It is rare, but it is present. There is cardiomyopathy in children, and they end with a mortality. So selenium deficiency causes Cashan disease, which is a cardiomyopathy in children, causes mortality. Cobalt important is because they are constituent of cyanocobalamin, which is B12. It is essential for normal function of all cells, especially in the bone marrow, the nervous system, and the GIT system. The daily allowance 2 microgram of B12, and the food sources liver, kidney, poultry, and milk. Cobalt deficiency, dietary deficiency is rare except when no animal product consumed in vegetarian or after gastrectomy and malabsorption syndrome. These are the causes of cobalt deficiency, although it is rare, but it's common. Chromium, this is associated with the glucose metabolism, and the daily allowance 0.05 to 0.2 milligram. That is present in the corn oil, in whole grain, cereals, and drinking water. Also, chromium deficiency occurs in severe malnutrition. Molybdenum is present. It is important as it is a constituent of essential enzyme. Daily allowance 75 to 250 milligram, present in different type of food, legumes, cereals, dark green leafy vegetables, orange. And deficiency here is unlikely. So we have to remember that micronutrient deficiency, we call it the hidden hunger. They are a trace element. Usually the deficiency seen mainly in developing countries and associated with protein energy malnutrition, maybe subclinical deficiency, or sometimes it is clinical, but it is delayed clinical symptoms. They diagnose late when they are moderate to severe cases and maybe severe cases. It includes, you have to remember that the micronutrient deficiency, the important part of the micronutrient deficiency occurs in developing countries are the following: iron deficiency anemia, iron deficiency disorder, and vitamin A deficiency. Thank you so much.